Hi, my name is Skylar. I'm going to be your nurse today. Today we're going to be inserting an IV into your arm. Can you tell me your name and date of birth? Okay, it says you have no known allergies. I'm going to start by washing my hands and providing the patient with privacy. Okay, to begin with, I'm going to get my kit ready. I'm going to start with the IV starter kit. I'm going to open it up. I'm going to get my tape ready. Okay. Now I'm going to assess the patient's arm for the site that I want to use, and I'm going to use this part of the arm, the lower forearm. So I'm going to prime my extension set. And this is sterile, so I have to be careful to maintain the sterility of it. I'm going to get my syringe. I'm going to take my alligator clip, which is sterile, and screw it onto the syringe. Take the cap off the alligator clip. Then insert it onto the extension set. Then I'm going to prime the extension set by inserting the air up until it meets the hub of that, and then I'm going to set it back down right here, maintaining sterility. Okay, now I'm going to take my tourniquet. And I'm going to use this part of the arm, so I'm going to apply the tourniquet about 6 to 8 inches above that. And at this point I would apply gloves. Now I'm going to clean the site that I want to use using an alcohol pad. I'm going to use this vein, or I'm going to use this vein right here. So I would clean this area of the arm, and I would let that dry for about 2 minutes. And while that's drying, I'm going to prepare my needle. I'm going to choose a blue 22 gauge since I am putting in the arm. And then with the bevel up, I'm going to insert the needle at a 10 to 30 degree angle, and I'm going to keep going in the vein until I see flashback, and I do, so I'm going to advance another millimeter, and then I'm going to push the catheter flush with the skin while retracting the needle, and as I'm retracting the needle, I'm going to occlude the vein down from the catheter. I'm going to set this needle safely aside. And I'm going to hook up my extension set, keeping the cap sterile on the end. I'm going to screw it on quickly, release that, make sure it's on, and release the tourniquet. Okay. Now I'm going to take the needle and put it into the sharp spin. Alright, now I'm going to take the tape and tape it down to the arm, right at the hub, and take my Tegaderm, and I would initial it, date it, time it, and put the gauge size on here before I ever put it on the arm. And I'm going to place that right above the hub too. And that's all right for now. Now I'm going to prepare my solution. The order called for sodium chloride, normal saline, going to open this. Eventually. There we go. Okay, now I have it open. And I'm going to maintain the sterility of the port. I'm going to take my IV, this is sealed, I'm going to take my IV line. I'm going to take it out, keeping the ends sterile. I'm going to take this end, take the cap off of the normal saline, and then take the cap off of the IV, and I'm going to push it down in there until it's snug. Okay, I'm going to make sure my roller is closed on the IV set, and it is. So now I can hang the IV bag on the rack. I'm going to pump the IV until it's about halfway full. Okay, and it's about halfway full. So now I'm going to flush the line. And I would flush the line until there's water all the way in the tip by rolling the IV. Okay. And since the fluid is all the way down to the tip, now I'm ready to connect it to the extension set. I'm going to carefully unscrew the syringe, and I'm going to carefully remove the cover of this, maintaining sterility of both, and connect it by screwing it on. Okay, and then I'm going to tape this to the forearm so it doesn't move around. And the IV is set. And then I would take off my gloves and record that I put it on the right forearm and the gauge size that I used. And then to remove it, I would wash my hands again, following doctor's order that it was to be discontinued. Wash my hands, put on gloves. Then I would start off by discontinuing the IV, whether it be the system or the drip. And I would start by untaping it from the patient's forearm. Being careful not to move it around too much. And then pull up my Tegaderm. And then pull off my tape around the hub. And then I'm going to pull out the catheter while holding pressure. And I'm going to hold pressure down on that and make sure the catheter tip is intact, and it is. And that's all.